Hello, my name is Dr. Dewan S. Raja. Today I will discuss about iliotibial band syndrome. Iliotibial band syndrome is a common overuse injury affecting the outer part of the knee, often experienced by athletes, particularly runners and cyclists. The iliotibial band or IT band is the lateral thickened part of the fascia lata. Fascia lata is the deep fascia of the thigh that extend from the hip joint capsule and tubercle of the iliac crest to the anterior surface of the lateral condyle of the tibia called Gerdy's tubercle. So it extends from the iliac crest, the capsule of the hip joint above, below to the lateral condyle of the tibia to the tubercle on the lateral condyle of the tibia. Okay, the IT band or iliotibial band receives the insertion of gluteus maximus and tensor fascia lata muscles, also called tensor of fascia lata. It stabilizes the movement of the knee joint. There is the function of iliotibial band. It stabilizes the movement of the knee joint, plus it is the site of insertion of two muscles. One is gluteus maximus, another is tensor of fascia lata. Okay, ITBS or iliotibial band syndrome occurs when the band becomes tight or inflamed, leading to pain and discomfort. The pathogenesis is that it comes under friction with that of the lateral condyle and may go through inflammation and undergo pain and discomfort. Causes of iliotibial band syndrome: overuse, repetitive activities such as running, cycling, or other forms of exercise. Biomechanical issue: poor running form, overpronation, leg length discrepancies, or weak hip muscles. Improper training: rapid increase in the intensity or duration of activity, inadequate rest, or running on uneven surfaces. Footwear: worn out or inappropriate shoes for the activity. So these are the causes of iliotibial band syndrome. So here is the iliotibial band, also called iliotibial tract. Okay, it receives the insertion of two muscles. One is gluteus maximus and another one is the tensor fascia lata. Tensor fascia lata and gluteus maximus inserting on that. Okay, and this is the Gerdy's tubercle, the site of pain. This is the Gerdy's tubercle. Is the site of lower insertion of the lower end of the iliotibial band is attached here in the Gerdy's tubercle. Symptom: pain on lateral epicondyle of the femur, which may worsen with activity. Jogging and downhill running aggravate pain. A snapping or popping sensation on the outside of the knee. Swelling or inflammation near the knee. Patient may have genu varum. So that may lead to the lower limb in pronated position, little bit medially directed position, so that the iliotibial band come in friction with that of the lateral condyle. Okay, so patient may have genu varum. Okay, Noble test. This is done by pressing on the lateral epicondyle of the tibia and asking the patient to extend the knee joint. Diagnosis is typically based on physical examination and the patient's activity history. In some cases, imaging studies such as MRI, ultrasound may be used to rule out other conditions. Treatment: rest and putting ice on the lateral condyle of the tibia, stretching and strengthening. Physical therapy. Physical therapists can provide targeted exercises and manual therapy. Medication: NSAID, non-steroidal anti-inflammatory drug like ibuprofen. Foam rolling. Using a foam roller to massage the IT band can help relieve tension. Proper footwear. Gradual return to activity. So these are the treatment of the iliotibial band syndrome. Prevention: warm up and cool down. Gradual progression, increasing activity level gradually to allow one's body to adapt. Strength training: incorporate exercise to strengthen the hip, gluteal, and core muscles. Stretching: regularly stretch the IT band, hamstring, and quadriceps. Proper footwear: use appropriate shoes for your activity and replace them when they become worn out. Cross-training: engage in a variety of activities to avoid overuse of same muscle group. And that's all about iliotibial band syndrome. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.